Hello, everybody. My name is Hannah. Today I will be going over irritable bowel syndrome, which is also known as IBS. Now, the reason why I chose this topic was because I did find myself getting confused between IBS and other GI diseases and disorders, such as UC and Crohn's disease. So, I hope you guys find this helpful and educational, and you enjoy the presentation. So, just a little bit of background on IBS. It is one of the most common GI conditions where it affects 11% of the global population. And patients who have IBS are at a higher likelihood of developing other functional GI disorders compared to the general population. It does have the potential to disrupt the daily lives of millions of people. Now, it is important to understand this disease process so that you know appropriate interventions or you know what appropriate interventions to take and appropriate recommendations to make so that you can help the patient reduce their symptoms and really improve their overall quality of life. A little bit of pathophysiology. IBS is a functional disorder of the intestines, specifically intestinal mobility, which is secondary to it can be from neuroendocrine dysregulation, infection or irritation, or vascular or metabolic disturbance. So it can be caused by multiple things, multiple factors. And in IBS, the peristaltic waves are affected at specific segments of the intestines, and it also affects the intensity of the peristalsis to which they propel the fecal matter forward. And there's no evidence of tissue changes or inflammations in the intestinal mucosa for a person who does have IBS. Now, regarding the nursing process, it's mostly recognizing if they have the risk factors for developing IBS, and it's also, kind of looking out for the symptoms and assessing for symptoms associated with IBS. So, the primary symptoms is alteration in bowel patterns. Now, this can include, only constipation, it can be only diarrhea, or it can sometimes be a combination of both at the same time. Other symptoms of IBS can be abdominal pain and abdominal distension. And, when a person, it's not uncommon for people with IBS to have abdominal pain relieved after they defecate. And then it's important to understand risk factors. And some risk factors can include, or actually contribute to the development of IBS, is a high fat diet. And regarding a high fat diet, I know one of the common diets out there that's getting more and more popular is the keto diet. So, kind of be aware if the patient who's suspected of having IBS, practices the keto diet or just has a high diet in general. Another thing that contributes to it is a high intake of stimulating food. This can include, caffeine, anything with caffeine in it, coffee or soda. And irritating foods can also contribute to it. This can kind of be different for everybody. Maybe like really spicy foods can irritate it. Alcohol consumption, smoking, stress, anxiety, and depression also play a role in the development of IBS. Now, for IBS, there's not like one single test that diagnoses a person with IBS. Rather, when you do try to diagnose it, it's more of, many tests being performed and run to confirm the absence of other structural disease processes or other disorders beforehand. And some of these tests can include things like stool studies or x-ray with contrast to kind of help rule out other disease processes beforehand. Now, IBS doesn't have a cure, so the most important thing is to manage the patient's symptoms and to really improve the overall quality of life. So, managing IBS does revolve around relieving the patient's symptoms, such as abdominal pain, controlling constipation and or diarrhea, and decreasing the overall stress level. And when you do manage a person who has IBS, it's very important to determine the types of foods that do act as irritants. And again, this can be different from person to person. Like one food that might irritate one person with IBS might not necessarily irritate another person with IBS. And when you do try to determine these irritating foods, one way of doing it is to restrict the suspected food that could be irritating and just remove it from that person's diet. And then you would gradually reintroduce it to their diet and kind of watch out if they're developing any of the signs or symptoms of IBS, again, which are diarrhea and or constipation, abdominal pain, abdominal distension. So it's really just kind of look out for possible irritating foods. And, some examples, again, the caffeinated products and beans can be irritating for some people because it can get some people gassy. Fried foods can be irritating because, again, those are high fat, and, spicy foods in general. And one way of managing IBS and controlling the symptom is to adopt a high fiber diet, which can help control the constipation and diarrhea. And in more severe cases, when you have a patient that has really bad diarrhea, sometimes anti-diarrheal medications and agents can be prescribed to help control that, because it can throw off the patient's electrolyte levels and, dehydrate them and just cause a whole bunch of other problems. Exercise can also help increase the intestinal motility, which helps improve symptoms associated with IBS, and it can also help reduce anxiety in general. And then as nurses, what we can do is we can help make basic dietary recommendations. And however, this is important for us to consider the patient's ethnicity and culture. So when we want to make recommendations, again, high fiber, lower fat, avoid irritating foods, avoid caffeine, smoking, and we can always refer the patient also to a dietitian if they want, and if we feel like it's necessary. So because they are experts in nutrition and they can probably provide more specific and better advice than we can. So you can always consider that. And regarding the patient's ethnicity and culture, for example, if you were, we live in a multicultural society. We have people from all kinds of races, backgrounds, ethnicities. And one of the important things, if we're trying to deliver quality care as nurses, is to be familiar with some of the basics of different main cultures in the United States. So, for example, if I'm trying to make a recommendation for a patient to, increase their dietary intake, and the patient is, for example, Middle Eastern or Arab, one of the recommendations we can make is maybe increase lentil soup intake, because that is a very popular dish in the Middle East and it is very high in fiber. And it is a good recommendation because especially if you have a patient that eats ethnic food and you want to increase their compliance to the diet and the overall compliance to the treatment. So it's important to keep that in mind. And another thing is, if you have a pediatric patient, for example, you can always, whoever's in charge of the patient's food or cooking, like maybe the pediatric patient's mother or father or their parent, you can always educate them on, foods to cook and feed the patient versus food they should avoid as well, to also help increase the compliance to the overall treatment plan. Another thing in this country is there's a lot of different religions out there, and it's important as nurses to be aware of some, dietary restrictions when we are making these recommendations, because, certain religious beliefs, such as Hinduism, many Hindus do not, many of them are vegetarians, and even Muslims, they don't eat pork. So, it's important to understand some basic dietary restrictions that your patient may have, whether it's cultural or religious. Another thing is, for example, if you're a nurse that decides to work in the city of Dearborn, which has a very high Arab and Muslim population, it would be very helpful to educate, yourself as a nurse about, the main, you know, uh, the main cultural beliefs or religious beliefs of the Arab and Muslim population, so that you can provide better patient care and really, increase the patient satisfaction in their care and the overall quality of care. And then, in regarding evaluation, as nurses, mostly we're gonna evaluate, determine which foods that do irritate the patient versus the foods that don't, and that do and don't exacerbate the symptoms as well. And the main thing we evaluate really is for the improvement of symptoms so that they can improve the overall quality of life. Now, how will this impact my nursing practice? One, I can practice with a little bit more confidence because, now that I'm aware of IBS, I know that I can, I'm probably going to encounter multiple patients that do have this condition, and I'm able to recognize the needs of my patients, and by doing so, I can make appropriate nursing diagnosis, appropriate interventions, recommendations, and plans for my patients to improve their overall nursing care and, again, patient satisfaction. So I hope you guys all found this helpful, and maybe you guys can use this as a study tool as well. And I wish you guys all the best of luck for the remainder of the semester. And again, best of luck to all of you guys.